Good afternoon. This is Dr. Chris Ebert Santos at Ebert Family Clinic. We want to lift our hearts and voices with the peaceful protesters in Breckenridge and Frisco who are emphasizing Black Lives Matter. Everybody deserves equal treatment, equal access to health. 18 million Americans do not have health insurance. 50% of minorities such as Black Americans and Native Americans do not have health insurance or adequate health insurance. Add that to their increased risk of medical complications such as diabetes and heart disease, and social barriers such as no paid sick leave. We need improved Medicare for all so that everyone can access the healthcare system, be safe and healthy. We also need to support our local newspaper, Summit Daily News, and all small town newspapers are critical for knowing what's going on in our community. Not only the movements, what restaurants are open, what activities are available, what we can do to support or to hold accountable our local politicians, our local police departments, what they are doing to support this community. Local journalism is critical in our American society and democracy. Also need to appreciate that we live in an area with lots of outdoor opportunities. Outdoors, that is what all the experts are saying for preventing COVID infections. We can go to the marina and rent boats, get out on the water. Besides hiking, biking, now we're going to have our walking main streets in Frisco and Breckenridge. We still want to do social distances and wear masks if we have to be close to somebody. We even have outdoor worship services for some of our churches. So we can have a wonderful summer. Now, Summit County Department of Public Health will be continue to do testing on anybody who has possible symptoms of COVID. And then they will be tracing any contacts of positive cases. These contacts will include anyone who has been within 6 feet of a COVID case for more than 15 minutes. These contacts will be traced and tested if they had contact with the affected individual from the time period of 2 days before the diagnosis to 7 days after the onset of symptoms. Even if you test negative, you would still have to quarantine if you were in contact with a positive COVID case. Recent medical studies have been published that show that wearing a mask can protect you even when within 1 meter or 3 feet of a possible COVID spreader. So that's important. And wearing eye covering can be essential for those of us who are working in high-risk occupations at the hospital or in clinics where we may come in contact with somebody who is infectious. We are challenged by the patchwork response that has occurred in the United States to this pandemic. Some states opening, some states not reopening, different cases accelerating in rural areas. It would be beneficial possibly to have a more coordinated national response. The federal government has more funds and could coordinate distribution of supplies. However, local governments do have a better idea of where the high-risk areas are, where the resources are. So we do have this state-by-state, community-by-community response to the pandemic. And I would emphasize that each of us just do our part by wearing masks, washing our hands, social distancing, not touching your face. If you're going to expand your bubble and visit grandparents, do it carefully. Talk to the people that you're sharing your lives with to see who they're sharing their lives with. If you're going to travel, look at the incidence of COVID cases in the areas that you're planning to travel to and through. And be very careful when you come back to avoid the high-risk people in your life for a couple of weeks to make sure that you are not carrying the COVID virus back to your family members. Thank you for joining us today, and if you have any questions, please don't hesitate to call us at 970-668-1616, and also explore our blog, highaltitudehealth.com. It has a lot of good information about all things altitude.